Hi, I'm Gary White for Central Kentucky Television. I'm here with Dr. Samuel Kriegler, who is with Springview Urology at 420 Loretto Road, Suite 600 here in Lebanon. And Dr. Kriegler is new to our area, just coming from the Minnesota area. And one of the specialties that you deal with in urology is with prostate, correct?
Correct.
Now tell us a little bit about some of the issues that are generated with prostate.
Well, first of all, you have to realize what the prostate is. And it is a gland that sits at the base of the bladder. The urinary channel from the bladder through the penis goes right through the center of the prostate gland. So the function of the prostate gland is to supply about half of the fluid when you ejaculate, and it helps nurture the sperm until it can reach the egg in the female, and that's its main function. Now, as the prostate enlarges as you get older, it can cause blockages of urine flow, which can cause a slow stream, getting up at night, urgency of urination, and eventually, if untreated, can actually shut the urine flow off altogether. Now, in addition to these benign problems with the prostate, which also include prostate infections, you have prostate cancer. Now, prostate cancer is the second most common cause of death because of cancer in men. Really? So it's nothing to be thought of lightly. As a matter of fact, about the same number of men will get prostate cancer as women get breast cancer. So the only cancer in men that's higher than prostate cancer is lung cancer, and that's due to smoking.
So prostate cancer, however, is detectable, and if found early enough, is easily treatable. Is that correct?
That is very correct. The AUA has just come out with recent guidelines concerning the PSA. We used to think that everybody should get a PSA once a year from age 50 till about age 75. And there's a lot of waste in doing it that way. And there have been studies that show that most men don't need to be screened on an annual basis. But every man needs to have a baseline PSA sometime around 45 or age 50. They need to have a digital rectal exam done, preferably on an annual basis. It can be done by their primary care physician. And if the PSA is below 1, you probably only need 2 more PSAs for the rest of your life. One being in the mid-50s and one being closer to 70. However, anybody who has a family history of prostate cancer needs to be regularly and annually checked. Same thing if in Afro-Americans, they have a higher rate of prostate cancer, and for that reason, they should be screened more often as well. If you find an elevated PSA or a lump on your prostate gland, then you have to determine is this cancer or not, because you can feel a bump that may not be. You can have a rise in the PSA due to many other factors, including enlargement of the prostate gland, infection of the prostate gland, a recent exam just prior to having the blood test drawn, or even relations the night before. But once you have a significant elevation in the PSA or a physical finding on the digital rectal exam, the only way you can diagnose prostate cancer is through a biopsy. And the biopsy is done in the office using ultrasound. And the ultrasound takes pictures of the prostate gland. It can detect certain areas within the prostate gland that might be suspicious, but not always. You can measure the gland, and then using the ultrasonic machine, you can specifically biopsy areas of the prostate gland. And what you see on the screen can be targeted and hit very precisely. We usually take 12 biopsies, and if you see something that looks suspicious, you make sure that you take the biopsy from that area. Now, once you've diagnosed prostate cancer, there are a lot of factors in what you should do. If you're elderly, 75 or more, if your life expectancy due to other medical problems is less than 10 years, you might elect just to watch and observe, and if necessary, institute hormonal therapy to bide time and But the younger the person is, the more important it is to treat the prostate cancer. And prostate cancer comes in a very slow growing form and a very aggressive form, and there are variations in between. So what we need to do is determine how much prostate cancer is in the gland by how many biopsies are positive, what the grade of the prostate cancer is by what the pathologist tells us when he looks under the microscope, and then you present a series of potential treatment options to the patient. Now, there are 5 basic things you can do for prostate cancer. One we talked about, doing nothing but watching and treating if it seems like the cancer is progressing. Another one is hormonal treatment, where if you remove the male hormone from the person, whether it be surgically or using medication, the prostate cancer stops growing and becomes inactive for a period of time. It does not cure prostate cancer, but it does palliate and treat, and a person can live anywhere from 5 to 15 years on hormonal treatment. But in a person where they have aggressive prostate cancer, high-grade or mid-grade prostate cancer, who are younger, some form of definitive treatment should be done. And there's 3 things you can do for that. One is radiation, which has a series of complications and side effects. Another one is surgical removal, whether it be the older radical prostatectomy, which was open surgery, or the newer robotic surgery for prostate cancer. But either way, it's still physically removing the gland with its, and the side effects and complications for either form are about the same. And then there's a newer way, which is very minimally invasive, called cryosurgery of the prostate, where you actually freeze the prostate. Now this can be done in half the time as an outpatient, or maybe they may spend just one night in the hospital. There's almost no pain afterwards. There's very little incontinence afterwards, to the point where mild stress incontinence, where coughing or lifting something heavy might produce a few drops of urine. But almost everybody has excellent control of the urine. And the only drawback to the freezing method is that when you freeze the prostate, you also freeze the nerves that supply erections. So if erections are a concern, maybe the cryosurgery isn't the right thing. But now if you can determine that the prostate cancer is located to a very small specific spot in the prostate gland, you can do what's called focal cryosurgery, where you just freeze the area where the prostate cancer is, preserving the rest of the prostate gland and the nerves. And it too is just as minimally invasive as the total prostate freezing, yet has none of the sexual side effects. So what I do once we've diagnosed prostate cancer is we sit down, all the options are explained to the patient. If the patient would want a treatment option that I cannot personally provide, such as radiation or robotic surgery, I will have referral centers that I can send these people to. It's very important that the patient has all the options and picks the treatment that they feel is right for them. For lower grade prostate cancer, or even mid-grade prostate cancer, a lot of different treatments will work. And you have to, and yet every treatment has its own set of side effects and complications, and you have to weigh one against the other. And what's right for one person isn't right for everybody. But it's important to give the patient enough information that they can make a logical and personal choice.
And have the different options that are available.
That's correct.
Great. Well, thank you very much. Again, I'm talking with Dr. Samuel Kriegler, who is with Springview Urology at 420 Loretto Road, Suite 600 in Lebanon. And again, the key is getting tested if you have a family history for prostate cancer, correct?
Yes.
And then having your PSA test or your rectal exam on a regular basis once you reach a certain age.
Yes.
Correct. Thank you very much.
Okay.
All right,
Thank
that's been
you.
Gary White for Central Kentucky Television.